we'll be exploring when our focus on body weight can cause harm to our health. Abby and I are both graduate students in clinical psychology from Canada, and we both study eating disorders. So our interest in this topic comes from our background of research and treatment of eating disorders. And just before we get started, I wanted to note that a lot of the information you're going to hear from us today will really run counter to things you might have heard in your life up to this point. But all of the information we're presenting is based on scientific research and literature in public health, psychology, and epidemiology. And throughout our presentation, you're going to see little QR links that you can scan for references and further information on these topics.
Okay, so I'm sure at the beginning of COVID and the lockdown period, we all saw these jokes and memes about weight gain during lockdown. Lots of people were worried about gaining weight or are distressed that they have gained weight. And actually, in a study of 900 young adults in the US, 40% of women and 46% of men agreed that it would be worse to gain 25 pounds during social distancing than to become infected with COVID-19. So why do these jokes matter? Well, on the one hand, we're joking about how weight gain and being in a larger body during a pandemic. And then on the other hand, we're talking about how harmful it is to be in a larger body right now.
You also might have seen headlines about obesity being a risk factor for complications and even death from COVID-19. And there were even suggestions that healthcare systems overcapacity start to triage access to ventilators based on someone's weight. And so if we're going to make literal life or death decisions based on weight, we better be sure that our assumptions about weight are correct.
So before we dive into our discussion about the relationship between health and weight, I want to give you an outline of what you can expect us to talk about. Samantha will start by talking about what weight does and importantly does not tell us. She'll discuss the obesity paradox as well as weight stigma and the dangers of it. I'll then talk about how focusing on weight can be really harmful. I'll teach you about weight cycling, what it is and why it happens, the relationship between weight and eating disorders, and we'll then move on into a discussion about weight and weight stigma in the healthcare system. We'll finish off with some take-home messages.
All right, so does weight tell us what we think it does? We assume that there's a direct relationship between having a higher body weight and having poorer health. But these assumptions are actually based on correlations between body mass index and risk for diseases like diabetes, cancer, and heart disease. So what is body mass index? Body mass index is a number that is derived from a mathematical formula. It's weight over height squared. So for example, if someone is 5'6" and they weigh 180 pounds, they would have a BMI of 29. This formula was created in the 1800s by a mathematician in order to record the average weight and height of a population. It wasn't until the 70s that doctors started to categorize an individual's health status based on their BMI. And today, the World Health Organization groups BMI values in categories that are meant to represent the amount of excess weight a person has. The assumption is that the greater the excess weight, the greater the risk to their health. But when we say that a higher BMI increases risk for disease, we're often using BMI to stand in for behaviors that we think are related to both higher weight and disease, like eating too many processed foods, eating too much, or not being active. But instead of actually measuring those behaviors directly, we measure BMI and then jump to conclusions about how people with higher BMIs must be behaving. An obvious problem with BMI is that it doesn't tell us what makes up someone's body mass. If you remember the formula that I showed a few minutes ago, it only included weight, not what made up someone's weight. To show you what I mean, this graph shows the BMI of athletes in European football, American basketball, and American football. Any athlete to the right of the purple line would be considered overweight based on their BMI. And anyone to the right of the red line would be considered obese. But you probably haven't heard any headlines about an epidemic of obesity in NFL players, despite this graph showing that many of them have BMIs that would be classified as obese. But that's because we know that the reason these players have heavier weights is because they have a lot of muscle mass, probably because of the physical demands of American football. But BMI doesn't tell us the proportion of muscle versus fat that makes up body mass. There are lots of other things BMI doesn't tell us. It doesn't tell us anything about what people eat, how active they are, or how much they care about their health. You can probably think of thinner people you know who behave in really unhealthy ways, and larger people who behave in really healthy ways. And most of us are probably somewhere between these two people. Some things we do are better for our health than others. But the point is, we don't know anything about these behaviors just from looking at their body size or BMI. The other issue is that if being overweight always causes health problems, why do we sometimes find that larger weights reduce health risks? This is called the obesity paradox because these findings challenge our assumption that a larger weight is always bad. For example, global studies have found that people with overweight category BMIs actually have the lowest risk of death, while the underweight category has the highest risk of death. The lowest risk BMI has also increased over time, and the class 1 obesity category have the same level of risk as the normal weight category. Additionally, in an American study, half of those with overweight BMI and a large group of those with obesity category BMIs were cardiometabolically healthy. And that means that they showed normal blood pressure, cholesterol, glucose, and insulin resistance levels. So relying on BMI alone would have classified millions of healthy people as unhealthy just because of their weight. The obesity paradox can be hard to understand, and it really goes against the conventional wisdom about weight and health. What I want you to take away from this is that the kind of indicators I just described, like blood pressure and cholesterol level, are better indicators of physical health than weight. And a higher weight doesn't always mean that someone will have higher blood pressure or cholesterol. This is why the association between weight and health can often be inconsistent in the research. Okay, and a final issue is that much of the research relies on correlations between BMI and health, and we don't know for sure what's actually causing this relationship. As a comedic example of what I mean, this shows the correlation between margarine consumed per person and the number of divorces in the state of Maine per year. This is an almost perfect correlation, but it would be absurd to say that eating margarine is causing divorces, or that we should start a public campaign to get people to eat less margarine to prevent divorces in Maine. We can immediately realize that there are other factors we haven't measured that better explain this relationship. We don't know why this relationship is happening unless we look at those other factors. This is also true of the relationship between weight and health. There are many variables that could potentially explain both changes in weight and negative effects on health. One explanation I'm interested in is that the shame and stress we feel about our weight might be what's really damaging our health rather than the weight itself. This theory argues that weight stigma is the key to understanding the relationship between weight and health. So weight stigma includes negative attitudes and stereotypes about people perceived to be overweight, that they're lazy, impulsive, and morally inferior. In media, larger people are disgusting and laughable, or they're headless zombies that we see on the news, along with the latest headline about the obesity epidemic. These negative attitudes are extremely common in the population, and discrimination based on weight is now more prevalent than many other forms of discrimination. There's also strong evidence that experiencing weight stigma over time leads to depression, anxiety, lower quality of life, and physical health problems. And while people who are perceived to be overweight bear the brunt of weight stigma in society, anyone can internalize weight stigma, which means that they start to apply these negative beliefs and stereotypes to themselves and base their self-worth on their weight. This can increase your risk for depression, anxiety, and eating disorders regardless of your weight. Weight stigma is also really stressful to experience, which might explain why it's related to both weight changes and negative health outcomes. When we experience something stressful, our body releases a hormone called cortisol. Cortisol does many things in our body. It drives us to eat more and it makes food tastier. It also increases the storage of fat in our abdomen. So experiencing chronic stress and high cortisol can actually lead to weight gain over time. Then if we gain weight, we might feel even worse about ourselves or get even more negative feedback from others, increasing our stress and driving the cycle again and again. We also know that chronic stress is associated with many of the health problems that we assume are related to weight. Some of the evidence that we have for this cycle includes studies that find that people exposed to weight stigmatizing messages eat more high-calorie foods afterward compared to people who didn't receive that message. Weight stigma could also potentially explain the headlines that I showed earlier, associating higher weight with risk for COVID hospitalization and death. We know that larger people often delay seeking healthcare because they expect to receive a stigmatizing response. So they might avoid going to the hospital until their COVID symptoms are more severe. Finally, by focusing so much on weight, we ignore other really important things that we do know are important for health, like having access to a variety of healthy foods, getting enough sleep, and reducing the stress in our lives.
So now that we've talked about some determinants of health, I'm going to discuss what can happen when we place such a large emphasis on weight. So weight is not as important as we think it is, and focusing on weight also has harmful repercussions. First, I want to do a thought experiment. Let's look at Hayden. Hayden walks nearly everywhere, eats lots of vegetables, cuts out sugar, works out for 1.5 hours every day, counts calories, avoids seeing friends if it interferes with their workout schedule, avoids going out to eat, even on special occasions, and doesn't eat food made by others. And so the question I have for you is, are these behaviors concerning? Are they concerning if Hayden looks like this? What about if Hayden looked like this? Are the same behaviors more concerning now? We'll come back to this later, but I wanted you to be aware how we might judge the same eating patterns differently just because people look differently. Like Samantha mentioned earlier, we have beliefs about weight and what it means, and these beliefs can lead to dysregulated eating. When people experience weight stigma or are worried about experiencing weight stigma, this can lead to emotional distress and people trying to manage that stigma by engaging in dysregulated and harmful eating patterns. So what is dysregulated eating? Well, that looks like dieting and rigid weight control behaviors, counting calories, trying to restrict and minimize your food intake, cutting out groups of food, obsessively planning meals, working out even when you're tired, injured, or needing to cancel or rework your plans just to stick to your workout schedule. And even though at the time we think that these behaviors will lead us to become healthier, it's quite the opposite. We know that dieting and rigid weight control behaviors actually predict weight gain and eating disorders 5 years later. We don't have time to discuss it today, but I've attached a QR code at the bottom which describes the Minnesota starvation study and how weight control behaviors and losing weight can lead to an unhealthy relationship with food. So let's talk about this relationship between dieting and weight gain. An important point to note is one that you've probably heard before: diets don't work. Or perhaps we should say that diets don't work long-term, because we can see that diets do work initially. But 95 to 98% of diets fail, meaning that people gain back the weight and as many as 2/3 of people gain back more weight than they lost. If diets worked, wouldn't there just be one diet that worked and you didn't have to keep going back to? The diet industry is a billion-dollar industry that highly values repeat customers. And before moving on, I want you to ask yourself, if a doctor told me I needed surgery, but that had a 95% failure rate, would I have the surgery? And so now I'm going to show you how this connection between dieting, eating disorders, and weight gain might happen. So what's happening when people gain the weight back with some gaining more than they lost? Well, we see this pattern that looks something like this. Maybe someone starts out by losing 10 pounds, and then they gain 20 pounds back, and then they lose 15 pounds, then they gain back 30, lose 10, and then gain back 15 pounds, and then it just kind of goes on like this. So over a period of time, throughout this cycling and gaining weight, we see that our weight can increase over time. And it's not really this weight gain that I want to focus on, it's the process of getting there. This is really throwing your body for a loop with this up and down, and it's most likely affecting your psychological health. So throughout all of this dieting, you can also lose touch with your internal sense of hunger when you're paying attention to external cues such as diet rules, the clock, calories, etc. You learn to not trust your body. And many people feel like this cycle is their fault because they lack willpower, and that maybe next time they need to diet harder. But I'll show you why willpower isn't the biggest factor in play. When you diet, your weight drops and your body thinks you're starving. So it starts to fight that weight loss in order to keep your body in a healthy balance. So you start getting cravings for high-calorie foods. And maybe you've noticed this. Once you lose weight, that's when you really want foods with lots of fat and sugar and maybe even taste better. Your hunger signals really get kicked into gear and you become hungrier. On top of this, your metabolism starts to slow down and it tries to conserve energy. So your metabolism adjusts in order to prevent you from losing more weight, and it tries to get your weight back up and it wants you to store fat. On top of this, the more you diet, the fewer calories you burn. So you have to restrict even more to lose weight and just to maintain it. If you've lost weight before and you've tried to maintain it, maybe ask yourself if once you get to a certain point, you just can't seem to lose anymore and it gets harder and harder just to keep that weight off. Similar processes happen at the psychological level. You might also develop some black and white thinking. So an example of this black and white thinking would be that maybe when you're dieting, you slip up and you eat something that's been deemed bad. So now that you've gotten that taste, you might as well go all the way. And maybe you even experience a loss of control and eat a great deal of food in a short period of time, or experience a binge eating episode. To reiterate, what we mean by binge eating is eating a lot of food in a short period of time and experiencing a loss of control. And when we talk about binge eating, I want you to think about going underwater for a long period of time and then coming up for air. What do? You don't take a normal breath, you gasp to get in all that air at once. And the same thing happens when we're hungry all day and not eating as much as our body needs. So when you finally do get that food, you feel like you can't stop. You might also be familiar with the Last Supper mentality. When you know that certain foods are off limits, when you start your diet again on Monday. So you have to eat them now while you can. And so with all of these factors in play, of course you gain the weight back. So next time you try a new diet, maybe a more extreme diet than last time, and you lose some weight, the same things happen again, and then the cycle continues. So again, these diets don't work long term. And a key message is that when it fights weight loss, your body is doing its job to keep you alive, functioning, and healthy. If you were food insecure, you would want your body to fight weight loss because that keeps you alive. So what are some potential consequences of extreme dieting, an intense focus on weight, and ignoring our bodily cues for hunger? An obvious and very serious consequence of our focus on weight is eating disorders. People with eating disorders often have a hyper-focus on shape and weight and an extreme fear of weight gain. This results in disturbances in eating behaviors, including restricting food, binge eating, self-inducing vomiting, abusing laxatives, and excessively exercising. Many people don't know this, but eating disorders actually have the highest mortality rate of any mental illness. So this is really a serious consequence. I want you to think back to the thought experiment with Hayden earlier. And I want to point out that eating disorders can't be diagnosed just by looking at someone. Eating disorders affect people's thoughts, personality, behaviors, and entire well-being, and we can't get an accurate idea of this just by looking at people. Diets and dietary restriction can increase the risk for developing an eating disorder across the weight spectrum. And regardless of weight, positive body image protects against disordered eating. Okay, so I've just talked about how our beliefs about health and weight and our behaviors to manage those beliefs have important consequences. And earlier, Samantha discussed what weight can and importantly can't tell us. Remember, she talked about COVID and healthcare outcomes. So now I'm going to go into some more detail about how others' assumptions about weight can be harmful. Unfortunately, discrimination in healthcare is really common. And as Samantha mentioned, now is a very important time with the pandemic to think about discriminatory practices in healthcare. We know that people with higher BMIs avoid the doctor in order to avoid weight stigma, and they may be hospitalized because they're waiting longer to get help. So what does weight stigma look like in healthcare? Well, research has shown that physicians are reluctant to perform certain medical exams on higher weight patients. They deliver less health education to these patients, and they spend less time with these patients than normal weight patients. And perhaps most importantly, higher BMI adults are more likely to say that they have been denied appropriate medical care. This is Ellen Maud Bennett. a devastating example of people in larger bodies being denied proper health care. Ellen died from an inoperable cancer after first being told to lose weight when she sought medical care. I'm going to read a few quotes from her obituary. Over the past few years of feeling unwell, she sought out medical intervention and no one offered any support or suggestions beyond weight loss. Ellen's dying wish was that women of size make her death matter by advocating strongly for their health and not accepting that fat is the only relevant health issue. So this is a very real, very tangible example of the harms caused by weight stigma in healthcare. And so if you are concerned about experiencing weight stigma in the doctor's office, this is a great resource you can use. These are helpful phrases that you can print out on a cue card and take them to the doctor's office if you are worried that weight stigma might impact the care that you receive. You can use the QR code to have better access to these phrases.
And we're also starting to see a shift among healthcare professionals recognizing these issues. So in Canada, there were recently new guidelines for physicians released by Obesity Canada that recognize that body mass index isn't an accurate measure of health and recognizes the importance of weight stigma and the potential health consequences of stigmatizing patients. And you could read more about these guidelines using the QR code.
So what do we want you to take from this talk?
Remember that you don't know anything about someone's mental or physical health just from looking at them. Don't comment on other people's weight because you probably don't know the whole story. Also, let's change our focus when thinking about our health. Think about your entire well-being or specific behaviors you might want to change or goals that you want to achieve. These are all more helpful to your overall health than just focusing on weight.
Remember what happens when we lose weight and how rigid weight loss efforts predict weight gain and eating disorders over time. Also, think about food rules and diets. I can't eat between these times. I can't eat this food group. I want this, but I'm not allowed to have it. Would you apply these rules to bodily cues of thirst or having to pee? So then why are our cues for hunger so different?
We tend to think that our body weight should be within a very, very small range, but we don't make these kind of prescriptions to erase variation in height or hair color. Let's recognize that people come in many different body shapes and sizes, and that's perfectly normal. And finally, you get to decide that weight no longer determines your worth. Your weight isn't what makes you good or valuable or loved by others.
Thank you so much for listening. We also want to say thank you to Dr. Jacqueline Siegel, who shared slides from one of her presentations. We adapted some of her slides for this presentation. And finally, thank you to the partners, chapters, and affiliates committee of the Academy for Eating Disorders for hosting this webinar. You can use this QR code below to access our resource document.